private Medicare plans. This is Wendell Potter's newsletter, healthcareuncovered.substack.com. And Healthcare Uncovered is the name of the newsletter. And his headline, private Medicare plans and vertical integration yield United Health $15.8 billion in profits just in the first half of the year, just between January and June. United Health announced, he writes, this morning, this was yesterday, that it made $15.8 billion in operating profits between the 1st of January and the end of June. That compares with $4.6 billion that they made during that same period back in 2014. So what took them from $4.6 billion to $15.8 billion? Medicare Advantage. And they just got busted in a big way by the Wall Street Journal. They did this, the Wall Street Journal did this whole story about this, and they pointed out that basically what these Medicare Advantage companies are doing is they're increasing their profits by refusing to pay for services. Because, you know, the Advantage plan, I mean, with real Medicare can't turn you down. If your doctor says you need an MRI, you get the MRI. If your doctor says you need a blood test, you get the blood test. If your doctor says you need a surgery, you get the surgery. There is no pre-clearance. Nobody has to call anybody and say, can we do this, please? With Medicare, they just pay the bill. If they suspect there's fraud, they go after them after the fact, you know, with the force of law. But, you know, they pay the bill. But with Medicare Advantage, the insurance company is always between you and your doctor, between you and the hospital, between you and the MRI machine or the X-ray machine or the clinic or lab. And so this is what the Wall Street Journal said. Insurer-driven diagnoses by United Health for diseases that no doctor treated generated $8.7 billion in 2021 payments to the company, the Journal's analysis showed. United Health's net income that year was about $17 billion. So, you know, this is how they're making their money. They're, number one, they're claiming that their patients are sicker than they are, or their clients or customers. And number two, when you do get sick, my recollection is, and don't quote this because I'm doing this from memory, but my recollection was that the New York Times reported a couple of years back that 17% of all claims are not paid for, maybe it was 18%, are not paid for people who have Medicare Advantage plans. And, you know, that means that if you go ahead and get the procedure anyway, and you end up with a $5,000 or $10,000 or $20,000 bill or even $500 bill for some lab work, because you got it before the insurance company got around to turning you down or approving the payment, you're on the hook for it. It's going to screw up your credit. This is, you know, and Medicare Advantage is not a good deal, I'm telling you.